next presenter is Dr. Sri Lakshmi. She will speak on visual outcomes of new refractive extended depth of focus IOL, a real life experience.
Thank you. Good morning, respected chair and my colleagues. I'm going to share my experience. I think it's not coming properly. This new implant, extended depth of focus IOL from Bosch and Lam, and it's known as LuxSmart, and I have no financial interest. It's a retrospective study. If coming to the optic principle, of an ideal lead-off, unlike a monofocal where there is a retinal blur circle at the retina, this can create a single elongated focus without compromising the retinal image quality, which extends the focus well. So we have various EDOF IOL designs, and this particular LuxSmart is based on spherical aberration-induced optic, and it's a non-diffractive hydrophobic preload IOL. It has a readoff center located in the central 2 mm with a combination of 4th and 6th order spherical aberrations of opposite signs, which is important, that enhances the depth of focus. And a refractive zone helps in the meant for the distance vision, and a transition zone which ensures no light loss. This retrospective study excluded corneal pathologies, retina pathology involving retina and optic nerve, and also eyes having astigmatism more than 0.75. So the IOL selection based on Barrett's universal tube taken on IOL Master 700. Varian is primarily used for the incision location. 2.2 mm was taken, and the priming of this IOL is very important. Little BSS injected on either side of the cartridge, and at the tip a little scholastic. Wait for 30 seconds before you implant in the bag. This step is important because it won't stuck in the cartridge. Ensure the centration. In the methods, post-operatively, the visual acuity is assessed for distance, intermediate, near, photic phenomena, satisfaction grade also, and how many of them achieved spectacle independence and contrast sensitivity. The study included 50 years of 35 patients, age ranged from 24 to 75. 22 males, 13 females were included. 43% received this IOL in both eyes, and 57% in single eye. The mean pre-op spherical equivalent minus 3.71 with plus or minus 4.2 with a duration of 6 months. 35 eyes underwent femtophaco, 15 eyes underwent phaco, and 5 myopes were included. The IOL ranged from 5 diopters to 24. The 2 cases noticed ERM were not clinically, not affected the visual acuity. The mean EDUA logMAR achieved 0.22. And coming to the visual acuity for distance, 80% were reading 6.9 and better. 6% only lost 3 lines. And intermediate vision, 80% of the reading N6 and 96% reading N8 and better. Neo vision, 76% were reading N6 and 86% reading N8 and better. The mean post-op spherical equivalent was minus 0.73 with plus or minus 4.3. So far, no PCO rate noticed. 10% loss of contrast sensitivity was documented. None of them combined photic phenomena. With 80% of them achieved spectacle independence with high satisfaction rate. Defocus curve assessed bilaterally, and majority were reading 6/9. Coming to the literature review, the first 2 reviews studies were compared with a monofocal IOL. This implant achieved good intermediate vision with no significant photic phenomena. 2 optical bench studies both agreed on the fact that it has given good intermediate vision, but the first study says pupil no dependence, but the second study says pupil dependence. Gawaki et al. Targeted low myopia, and in their study, only 25% were required glasses. And but this study happened on, inactive individuals. But my study included many professionals, including doctors, and with mini monovision strategy, this has achieved all the ranges of vision, and without any burdensome dysphotopsia and day-to-day life activities. Thank you.
Ma'am, what is your patient selection for these YouTube lenses?
They said, various EDOF designs. Each surgeon has preference. I chosen all the kind of EDOF IOLs.
Indications and contraindications.
Oh, initially we have chosen all clean cases, But later on, I started implanting in
I think he's
high
asking
myopes
which
as well.
test you have done.
Test.
Any test was done prior to selection of the patient for putting EDOF lens? Or
See,
you
it's a
just
regular
any
cataract.
patient and you
Any cataract patient asking for, some amount of glasses freedom. But as the multifocals, that with
is from the patient's point of view. But from doctor's point of view, did you do any test before putting that lens? Was any test
see,
done?
what test I didn't understand, but then I'm a regular.
We are talking about angle kappa and all that stuff. So
Oh,
was
those
it
things.
checked?
I've taken all regular cases primarily. There were high myopes included, but there's angle kappa because we do pentacam and OCTs, all that. So centration part, I got your question about the angle kappa, but I implanted in high myopes where diopter 5 also implanted, but the outcome was ecstatic.
So what was the highest myop which you have put lens, and what was the power of the IOL?
Power of the IOL 5
Acha.
diopters.
EDOF lens is available in that.
It is available in one diopter. 10 and above, it is 0.5 diopters.
And the satisfaction level was checked on any questionnaire or just you asked?
Questionnaire was asked, they are seeing any glare and halos, because there are few of my friends who are doctors, so they wanted a read off, so then I choose, and they were saying they could drive well and all that.
Thank you.
Yeah.
Thank you.
One question I have regarding the high myopes you have put these EDOF lenses. You have to be very careful about the angle kappa in them.
That's what the angle kappa was not very deviated. I have to see if there is any deviated angle kappa, then
in the routine
how
case
the
it's okay.
centration should be at the Purkinje
But high
level.
myopia, you have to be more careful about the implantation.
Yeah, that's true. But eye myopes primarily, it's whether monofocal or whatever. This behaved like a monofocal. That's a reason I have chosen in those eyes also.